the big challenge is that depending on what study you look at, for every dollar we put towards prevention. So I do want to say to you that there is a systemic sort of challenge that we run into where not just consumers, but the system itself, but more importantly, the doctors and the clinicians who work in the system, we're in this profession because we want to help people. And often the way we frame helping people is to solve their problems. I would say that less than 1% of doctors, the majority of their work is focused on trying to prevent disease. And, and someone says, look, that health service should be spending more money on prevention. I turn to you, Seb, and I go, where do you want me to take it out of? The big challenge is that depending on what study you look at, for every dollar we put towards prevention, we're probably going to get about between $10 to $14 back. Now, the problem is who are we going to take it off to do that investment? Which is why another principle in terms of looking at what we're doing with OneMRI is that the consumer being at the center of healthcare is super important, because I think in order to truly prevent chronic disease, it's not going to be about an awareness campaign or investment from the government. It's going to be about a cultural shift for the consumer. And if you follow the bouncing ball, for me, it's like if you're curious about your health, you're more likely to do something about your health, prevent chronic disease, live longer, live better lives, all those sorts of things.